now we're going to pause for a Q&A session, hoping that people have questions or, would love this to be engaging. No question is a stupid question. And we're happy to have a discussion at this time.
We do have 2 questions in the chat. One is, can you expand on options on if and how a patient could continue working while receiving treatment, telehealth treatment?
Sure. Steph, you want to take that one?
I was gonna say I could take the first one. Yes. As far as for the best use case scenario I could give you for this one would be is they maybe are working a 9-to-5 job. We have group options at all times of day. So we have them in the evenings, we have them, in the mornings, late mornings, and we're always looking to even expand on different times and things. So a patient could be working, and with there not being a commute to the office, it makes it easy. They can do it from their phone, jump on their group or their individual session. So I hope that answers your question.
Next question is, how long can a patient receive medication management services after being discharged from an outpatient program?
I'm happy to take that one. So I find this pretty exciting, but forever is the answer. So we are licensed as a behavioral health provider, and so historically we could provide care like psychiatric care and medications for opioid use disorder, alcohol use disorder, if you were enrolled and engaged in clinical services like IOP or OP. And that was very frustrating because we don't want to have this fragmented care that we keep talking about. So what we did was we started a physician practice, and we can actually bill physical health now. So while you would, or a patient would be with us for behavioral health, we would bill behavioral health, but for our MAR program, our medication assisted recovery program, we actually bill physical health. So we can continue to see a patient as if we are any other physical health doctor, like a primary care doctor. That's a really good question, and a really important one, because again, care needs to be integrated and not fragmented. And it makes no sense to have someone complete IOP and then say, well, good luck with your MAT. We'll give you a couple of referrals. But we've already made a great relationship with you, and you like us and you want to stay and we want to keep you, but we just can't. Now we can.
Okay, thanks. Next question. Does GRC do any additional training to prepare therapists to run virtual groups or individual sessions?
Absolutely. One of the first things I did when we came over, and I'll let Stephanie talk outside of supervision, but we're connected with the Mid-Atlantic Regional Tech Telehealth Center, and those are HRSA funded, and they're across the United States. So first thing we did was we trained everybody up on telehealth ethics, regulations, laws. So we've had competency trainings, certification trainings, de-escalation's the next one on the list, but every provider has to go through a training to be certified outside of our additional training that we do in Gateway as a whole. But when you come over to us, everybody has to have the telehealth 101, 1.0 competency, 2.0 competencies, risk training. Yes, we have that all documented, and I'll be sharing that the Matrix team website for everybody, because those are who we go to have additional trainings.
And Steph, do you want to add to that?
Absolutely. I love this question, Catherine. One of my initiatives for like our next fiscal year is going to be trying to do even more specialized trainings. It's not easy to be a telehealth therapist. So when we do our interviews, we really pay attention to, can we feel the emotion from, interacting with them? Because, we're going to be having these patients for a long period of time. So we want to make sure that, the therapist is good at engaging and, noticing things with the patients. So we do have like a 2-week in-house training that they get to observe other therapists running groups, and we also, as Matt said, we provide them with all of the resources for our EHR and MCare. And then we also are looking at doing more specialized, like focus of, how to incorporate more creative things or the use of technology within the group setting. I will say our therapists are pretty creative and they do come up with some good ideas on their own. And we do bi-monthly supervision, like group supervisions where they can share ideas with each other. We have a telehealth chat that's pretty active. And also in their individual supervision, if they're having any struggles, we work with them to hone in on those and help them provide more skills. Thanks.
Thank you. Dr. Julie, I had to mute you guys for just a second, so you'll have to come off mute again. Let's see.
Yeah, that's.
What happens if a patient experiences a crisis while in a telehealth treatment?
Steph, you want to take that one too?
Sure. So we are very, very adamant about like our workflow process of this because believe it or not, it actually happens more than you might think. And one of the things that we do is the therapists know they're essentially never alone. We are always here with them. In the Teams chat that I mentioned earlier too, if there are some issues, they can notify one of us through that. That's why it's really important kind of having all those multiple screens. So kind of being able to multitask is definitely a skill that you need for this job. But the process in doing that is typically the therapist will notify the supervisor. The supervisor can jump in the group, kind of see what's going on, and then make the best clinical decision after that. So without getting into the weeds on specific cases, that's like the very general answer to the protocol of how we operate.
Gonna come off you. And I don't know if you can hear us, Jody was showing you that within our MCare platform, the other reason is we know where their location is. So a lot of people think in telehealth, think about this, if I'm in Allegheny County as the provider, but you're in Wayne County, and there's a problem, if I pick up 911 and call as the provider, I'm calling Allegheny County that has to be transferred to Wayne. So we know exactly where their location is by being connected to our app. And we have the protocols for being able to call emergency services that also go down the other lane of the risk management. And we had training around that. So yeah, and if the patients, we dictate, we know where they are. Stephanie was role playing where their location is in case we have to have an emergency on site. We have somebody can get right to that property. So, yep, we have that. We've handled that in the past. Stephanie has done a great job, and outside of our internal policies and details, we handle it and locate where they are.
Okay, does the program have the capacity to add additional telehealth participants and contract with additional counties across Pennsylvania?
Yes, definitely. We would welcome any discussions with anyone who would
Yes.
like to talk further with us about that. And we're always happy to answer questions like this. It doesn't need to be in an open house. It's very easy to talk to us. And we welcome questions and discussion. Did you want to add something?
No, it's actually Dr. Diallo and I have meetings set up that we're meeting with in county, so we will absolutely come to you or do a virtual conversation with you. So we're going to be providing you all the information and call us and we'll be there, basically.
For sure.
Okay, at this time, we do not have any other questions in the chat unless someone would like
Great.
to add one or come off of mute.